Okay, we can get started. Hi, everyone. Thanks for joining us today. I'm Krista Gervon with Dr. Vin from Princeton Integrative Health. This is the InVINcinible Health Series, and today we're going to be talking about heart health. February is Heart Month, so we figured we would dedicate a nice piece of time to the heart and learn more about how we can keep it healthy and strong. So we're going to dive right in, and I'm going to ask Dr. Vinny, how did you get into working with the heart and helping people with their heart conditions?
Sure. Well, for many years, actually, I was an ER physician. So I saw people who were, in the throes of having their heart attacks. And, certainly that interested me, taking care of that. But then when I became a person with heart disease, certainly made me really want to learn how to prevent heart disease in people. So, do you want me to tell my story now?
Sure, yeah, go ahead.
Yeah, so, I was a ER physician, as I mentioned. I was a marathon runner. And so I thought it was good. I didn't think I was going to have heart disease. I was eating the American Heart Association diet, which many of you may now know was created a generation of people who were obese and diabetic. But I wasn't obese, and I wasn't diabetic, but I was out for a run one day, and I developed chest pain, severe chest pain. I had to stop running. So, I was wondering what was that. And so I went and had a stress test, and I flunked. And then the next day I had a cardiac cath, and it turned out that I had an 80% blockage in one artery, one coronary artery, and 70% in another.
Wow.
So that made me interested in, if me, who was a doctor who was up on the latest on what was going on, could get heart disease, what chance did other people have? So I became interested in helping people prevent heart disease at that point.
Okay. So that basically changed your whole trajectory of your life in medicine and in the medical world.
Yes, it took a few more years to get Princeton Integrative Health going, but yeah, I started questioning, what was I learning in conventional medicine? Why weren't I able to prevent that? Why did I get it? And I wasn't finding any answers. And so I eventually turned to integrative medicine, and that Princeton Integrative Health was born out of that.
Yeah. So now that you're working in a more integrative approach toward healing people, especially with heart conditions, what types of heart conditions are people coming to you with that maybe their conventional doctor wasn't able to treat or, even find the issue?
Yeah, so we have people who are coming to us who don't know if they have heart disease yet, and we're testing to see if they have that. And we'll talk more about the testing in just a minute. But to people who already have had a heart attack and are wondering what they can do, what are the other things they can do to prevent themselves from having another one. So it's that whole gamut.
What would you say the biggest difference is if someone's coming to a conventional cardiologist as opposed to coming to a doctor like you?
So, you would probably go to a conventional cardiologist if you're already having chest pains and you need like a stress test, something to diagnose what's going on acutely.
Right.
Say you have some symptoms. For me, I want to know if in 10 or 20 years you're at risk for having a heart attack or stroke. And we do a specialized test, a specialized vascular ultrasound called CINT that can see the wall of the artery, see if there's inflammation or plaque there. And if you have inflammation or plaque, that places you at risk later on down the line. But we can see that 10 to 20 years before you have a problem. So the beauty of that is we can actually do something about it. Instead of, you're on my table in the ER, having
Right.
a heart attack already.
Oh,
Oh,
yeah.
it's a little too late by then.
It's not the time we want to be doing that. So, I mean, you just mentioned the CIMT. We are having CIMT appointments available at our office Wednesday, March 18th. The appointments are only 15 minutes long, and you can come in between 8 a.m. and 12 p.m. So give our office a call at 609-512-1468 to schedule that, because you may be at risk and you might not know it yet, as Dr. Vinny just explained. And I'll post more information about that in the chat later on. But I did want to just also ask, down to the brass tacks, what actually happens when you're having a heart attack or another type of cardio event?
So what actually happens is that, plaque, which is a collection of cholesterol and inflammatory blood cells, is in the wall of the artery. So that's what plaque is. And plaque does not just develop because of cholesterol or high cholesterol, by the way. That's a whole different discussion. We'll do that topic some other day. But part two. But so if you have some plaque and it gets inflamed and it ruptures, the body senses that and senses it as an injury to the blood vessel wall. So when the blood vessel wall gets injured, the body wants to stop the injury, wants to stop the bleeding, if you will. So it puts platelets there, which stop the bleeding. But unfortunately, what happens, that gets into a cascade, and if enough platelets clump there, it blocks off the artery. So if you block off the artery, no blood is flowing, and that's what we would call a heart attack. If it happens in the carotid artery, we call it a stroke.
Okay.
If it happens in an artery in the leg, peripheral arterial disease. But, the major ones we're concerned about are heart attack and stroke. And yeah, that's actually what happens, so it gets blocked off, so oxygen can't get to the heart muscle or to the brain. And if that is not reversed, then a part of either the heart muscle dies or the brain dies. So that is what I want to prevent, because obviously that can be catastrophic for some people. Some people have, quote, mild heart attacks or, quote, mild strokes or mini strokes, and they come back, but that process is still there, and they have to be especially careful, vigilant, to make sure it doesn't get to be anything worse.
Right. So,
But
go ahead.
But unfortunately, for some people, it's catastrophic. They either have a big heart attack or they have a sudden death because they have a heart arrhythmia because of that whole process, or a severe stroke. So, heart attack after over 100 years is still the #1 cause of death, even with all our technology, even with all our medications, still the #1 cause of death in the country, and stroke is the leading cause of disability. So I'm trying to get the message out there that we have to do something about that, that we have to intervene in a different way than, we intervene in conventional medicine. We have to find it well before that happens and literally change people's lives and lifestyles to make sure it doesn't happen to them.
Yeah, and I was going to say, the CIMT, this type of ultrasound, isn't for people necessarily, only people who have risk factors. It's really for anyone, right? So because you don't know if you really have a risk.
Yeah,
heart attack.
that's really the lesson of my story, right?
Right, exactly, just like you.
I mean, I guess I sort of knew I had a risk factor. I had a dad who had a heart attack at the age of 47, but he was 60 pounds overweight and he smoked Lucky Strikes.
Right. So that
I didn't have those risk factors.
Yeah, exactly.
So I didn't think I didn't think I was going to have heart disease.
Yeah.
But it turned out that I had an inherited lipoprotein disorder. Cholesterol are a type of lipoprotein, but there's another lipoprotein called lipoprotein A that is not routinely tested for in the United States. Tested for in Europe, but not the United States routinely, unless you ask for that test. But it turns out that I have it. Now I know my brother has it. And my sister has it. We all have it. So now we're aware of that, and we can do something about it. Right. But I didn't know that before, my first episode of unstable angina while I was out for that run. So yeah, the CIMT can tell you, even if you don't know what your risk factors are, can tell you that your artery is, in a risk state, that you have developed inflammation and plaque, and then you can go looking for those other the non-conventional risk factors. So that's also what we specialize. It's not just the CIMT. I do a lot of inflammatory markers that are not done routinely, and other blood tests to help elucidate that risk. And certainly, if you don't have risk factors, I think you should have this done at least once just to make sure.
Right.
Anytime after the age of 45 would be fine, 50. But certainly if you have a family history or anything like that, especially premature heart disease or stroke, you should have that done. And we need to get the word out about this. We need to tell our family and friends and loved ones. We need to tell the people who, we know have had family histories about this.
Yeah.
Because otherwise, unfortunately, I think we all know people who have, had a heart attack or had a cardiac arrest, and sometimes even right after they've been to the doctors and gotten their clean bill of health. I would see that in the ER, frequently, unfortunately.
And like you said, and even in your own experience, even if you are trying to break the cycle, you're working out, you're eating healthy, you're not smoking, things like that, there might be a genetic component that you may not know about. So it's important to come for the screening, just as part of your toolbox of preventative health and, caring for your overall well-being. But what are some other types of things we can do besides the screening to keep our heart healthy, maintain a healthy heart?
Maintain a healthy heart. Yes, that's what we want everybody to aim for. It's for many of these things, it's the same foundational stuff. Eating a diet that's low in carbs and high in plant nutrients. Low on the red meat, high in fish. Activity. Doing your activity, getting 30 minutes of moderate intensity activity at least 5 days a week. So, walking at a good pace would qualify. Running, biking, spinning, whatever you enjoy. Getting enough sleep, 7 to 8 hours of sleep a night. Getting tested for sleep apnea. Sleep apnea is one of the main underdiagnosed conditions that leads to heart attack and stroke and dementia.
Wow.
It is so important for people to get tested for that because it's not always obvious. And I've tested people who are like, oh, I don't have trouble, I don't snore. You can still have a certain type of sleep apnea called central sleep apnea where you don't snore, but you don't breathe for period of time and your oxygen goes down during the night.
That's great.
And the final thing, the other thing is to make sure that you're doing something that helps you manage the stress in your life, whether that's meditation, Tai Chi, yoga, reading a good book, crocheting, whatever you like, do it. Enjoy yourself.
I do see a theme from every week here, no matter if it's heart health or brain health or anything like that, you need to maintain your stress levels and do things that you enjoy doing to keep it low. So, that's definitely an overarching
theme. Everybody should be doing those things. That should be the foundation of what you do. And then you should make sure that you don't have the risk factors. Just like people get a colonoscopy, most people get a colonoscopy when they turn 50 to prevent colon cancer. You should be getting a heart disease checkup, if you will, to make sure you don't, your blood vessels are looking good and going to carry you for another 50, 60 years. And making sure you're not suffering from any risk factors for dementia. Those are other things that really haven't been built into the American medical system just yet, but are built into practices like mine.
Exactly. And so if someone is going to come in and make their appointment for March 18th, they'll come in for the procedure. And then what happens next after their results come in?
So after the results come in, I review them. And, we have an appointment where we go over that. I tell people, what their, how their arteries look, gives people a projected arterial age versus their chronologic age. If your arteries are younger than your chronologic age, you're in good shape, and if they're older, then there's some stuff we need to work on. So
awesome, and then you'll just kind of take it from there and see how their progress goes.
Absolutely, yep.
All right. Well, is there any other bits of advice or information that we can leave our audience with today on how to best take care of their health before we?
Yeah, I would say that, get off your backsides and get walking and get a checkup to make sure that things are okay.
Yeah, we got a taste of spring this week. So I driving or walking outside, I could tell that there were so many more people out just because it was nicer and the sun was shining. So even if it's just a walk, get out there and get moving and stay healthy.
Absolutely.
I will. I'm going to put right back in the chat our phone number really quick so that people can. Actually, I'll put it on the Facebook. Call in to make their appointment. It's 609-512-1468, and you can make your appointment again for March 18th. They're 15-minute appointments, very short, between 8 a.m. and 12 p.m. I'm going to just check the Facebook really quick to see if there's any questions. And otherwise, what's the topic for next week, do we think?
The topic for next week, I think actually we're going to talk about we have a detox for coronavirus vaccine.
Right.
That we so I think we'll put that on. So we'll talk about that.
Okay, great.
Sure.
Yeah, some information out there. There is a question. What are the latest innovations to treat sleep apnea? There seems to be less annoying devices versus the masking hoses, etc.
Yeah, so actually we were just talking to a dentist today who specializes in sleep medicine, and people seem to be moving a lot more to oral devices that are customized to your mouth and help just keep your mouth open. So if you have moderate sleep apnea, you can certainly use that. And those, as I said, those are customized and they're adjustable. And the idea is to make sure you have something that you're comfortable to sleep with, because otherwise you're not going to use it, which is the problem with CPAP oftentimes, that people stop using it because it's uncomfortable. You turn over in bed and you get tangled up in the hoses. And so if you have moderate sleep apnea, you can use an appliance, or if you have severe, even for some people with severe sleep apnea, if they really can't tolerate the CPAP. I mean, CPAP is the gold standard, but if they really can't tolerate it and they're not going to use it, then probably getting an appliance to help keep their airway open would certainly be something they could try.
Okay. All right. Well, those are all the questions we have. Thank you, Dr. Vinny, for all that information about our heart health. Before we leave, I just wanted to remind everyone I will be on live with Dr. Connie tomorrow at 12 noon to kick off the Dress for Health Success series. She'll be going over the D, which is for diet, and how that works together to improve our overall health, which we've obviously talked a lot about in this series as well, but she'll take a deeper dive. All right, and we'll hope to see you next week on the InVINcinible Health series with Dr. Vin. Thanks, Dr. Vinny.
Thank you, Krista.
Have a great day.
Bye. You too.